Hello, friends, and welcome to episode 589 of the Juicebox Podcast. I had a terrific conversation with Arwa. Let me tell you a little bit about her. She came to the United States from Saudi Arabia. When she got to the United States, she got herself a PhD and then moved back home, where she is now a nurse scientist and the first pediatric nurse practitioner in the country of Saudi Arabia. I think you're going to find that our conversation is about more than diabetes. It's about how difficult change happens, and it shines a spotlight on one person's effort to make that change. Please remember while you're listening that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan or becoming bold with insulin. If you're from the United States and have type 1 diabetes, or from the United States and care for someone with type 1, please take just a few moments to go to t1dexchange.org/juicebox and fill out the survey. It'll only take you less than 10 minutes. It helps people living with type 1, it helps research, and it supports the show. This show is sponsored today by the glucagon that my daughter carries, Gvoke HypoPen. Find out more at gvokeglucagon.com/juicebox. Today's episode is also sponsored by Touched by Type 1. Please head over to touchedbytype1.org or find them on Facebook and Instagram. Touched by Type 1 helps people living with type 1 diabetes, and you may be very interested in how they do that. There are links in the show notes of your podcast player and links at juiceboxpodcast.com to these and all of the sponsors.
My name is Arwa Al Hamed. I am from Saudi Arabia. Identifying myself as a pediatric nurse practitioner. Right now, I'm not practicing per se, but I'm an assistant professor at the university in the School of Nursing, where I am teaching pediatric nursing to undergrad. I'm also doing clinical instructing for the pediatric nursing care course. I'm also involved in research with pediatric who are affected by chronic illnesses, focusing on their cognitive functions, psychosocial health, as well as transitioning and quality of life.
Wow. Okay. Well, how does that all happen? Let's, how old are you?
I'm 33,
Have you been
reaching 34.
Have you been in college since you were 7?
Yeah, I think I've been in school most of my life.
Mm-hmm.
I practiced nursing on the bedside for 3 years, but then I immediately joined the postgrad, where I just came back from the US actually 2 years ago. So yeah, for more information, I did my master and PhD in the US, part of it in New York, and then the other part in Ohio, Cleveland. This is where I met Julia Blanchette.
That's right. And Julia, who's been on the show a number of times, and she introduced us. Yeah, that was really sweet. So how do you, when you decide, I don't want to be a bedside nurse anymore, I'm going to get a PhD, what's the search like for where to go look for it?
Right. So it was not a time where I didn't want to do bedside. I would never stop doing bedside.
I see.
But at that moment in the place where I was working, it sounded to me like a dead end. And I found myself into studying more, specializing more in academic areas, because at that time, my only option was either to continue to be only on the bedside or do admin work. The career path for nurses at that time was not promising from my perspective, in terms of higher education. And I was always hoping that I finish my undergrad and then proceed to master's and PhD immediately. I was worried that continuing to be on the bedside area will prevent me from doing my master's and PhD. At that time, there was no option to go to do my master's and PhD through the hospital. So the only option was to me is move to academia.
I see.
And there was an opening, and they wanted people to come and work there as teaching assistants, and then they would sponsor them to go and do their master's and PhD. So they come back and teach at that time, and we still have a big shortage in faculty in the nursing undergraduate studies.
What's the length of time you spent in the U.S.?
About 7 years.
Wow. By yourself, or did you go with family?
No, by myself. Of course, family would visit every now and then.
No, but still, you moved from where you are now to
yes,
like the Midwest of the United States, or I guess not really. Where were you in Ohio? Right?
I started in New York. Actually, I was very shocked with the snow. So many times I wanted to go back just because of the snow. So I'm very glad that my brother was with me initially. He came with me for the first 3 weeks to just help me settle, etc. If he wasn't there at that time, I would have been already in Saudi, because I couldn't stand the snow. It didn't make sense to me.
Yeah, the people listening.
How it's that? Yeah.
The people listening will know, because we started recording after we talked about it. But you started in a room that was a little noisy, and I said, what is that? And you said, it's air conditioning. And I said, can you turn it off? And you were like, no, I'll die. And so, the snow must have been. I mean, what's the temperature outside where you are now?
About 102. Wow. 100, 200. Yeah. And that's only the beginning.
And your summer runs concurrent with ours. So you're in spring right now, moving into summer?
Yes. Yeah. But, our spring is basically your summer. And then it gets different summer that you'll never have. Hopefully you'll never experience, unless you happen to visit in the summertime, which I don't recommend.
You think I'll just burn up like a piece of paper, probably?
Especially in the central parts of Saudi. If you go south, it would be nicer. It's mountainy, hilly. Mm-hmm. But in the central area, it's really, really hot and dry and dusty. We get lots of sandstorms. So you know how you guys spend most of your winter indoors. Mm-hmm. We have the same thing, but in the summertime. Most of the month we spend in the summer are indoors, just because we cannot do anything without the AC. So you're either in a mall, in a restaurant, or in the house. Yeah, mostly indoors.
And the trunk of your car has 7 cases of water in it, just in case you stop.
Yeah. Actually, you wouldn't do this because it will be very hot. It's not good for drinking anymore.
What about in the evenings? How much does it cool down?
It's still very hot. Sometimes some nights are nicer than the others, but generally it's not really nice.
Gotcha. Wow. That sounds terrible. But I understand being scared by the snow, because I hate the snow and I was born here. So you see it, and that wind, right? Especially in New York City, people who've never been there don't know that the wind whips one way through the city. So you can be walking down one block where you're shielded from it, and you're just like, oh, this isn't so bad. Then you get to the intersection, and a wall of frozen air just hits you and doesn't stop.
Right. It will make you be tearful. I didn't know that kind of a phenomena. When you feel like you were crying in the middle of the wind just because of how strong is the wind.
Yeah. No, that must have been a heck of a shock. Okay, so you were in New York for a while, and then you went to Ohio after that?
Correct.
Okay. So you get a master's, and what was your PhD in?
So I did my master's as a pediatric nurse practitioner, and I finished and immediately got accepted in Case Western in their PhD of nursing program. And my focus was basically the cognitive functions together with some of specific cognitive measures and quality of life in children who are living with chronic renal disease or early stages of renal failure.
It's interesting. Let me ask you another question before I get to that, though. The U.S. health system versus what you were coming from in Saudi Arabia. Were there vast differences or was it fairly similar? What did you find?
Okay, so right now we kind of have both systems. If I would say yes, the Saudi has the government funded healthcare system, meaning that every Saudi citizen is entitled for free healthcare, and we have certain amount of government hospital. In addition, we also have private sector like health services being offered through private sector, meaning we have hospitals, private hospitals, that if you want to go pay out of your pocket, you can still do that. Now it's increasing. It seems like the country is even now giving more support to private companies to open and establish more hospitals, clinics, etc. So both of them are flourishing at the same time. Generally, everyone is entitled for this, especially also those who go to the military or work in the military or in the National Guard, for example. In my case, they also can have their access to their military hospitals. What happens is because of that, still you're not going to get quick access to healthcare unless, of course, if it's emergency. Emergency rooms are open, but thinking about dental health, dermatology, or like those primary healthcare services, we will have to wait sometimes months to get appointments. And this is where you might choose to go to private. So not completely, for specific services if you need.
For speed
there
of being
are also
seen. I'm sorry, for the speed of being seen, or are there quality differences as well?
No, mostly for the speed of being seen.
Okay.
I'm pretty lucky living in Riyadh because we're still a little bit centralized where all the good services are located in Riyadh. So usually, or in this case, the government hospitals as well as the private hospitals offer pretty good quality. I personally would choose to go into government because most of the government hospitals are educational or university hospitals. So you're being treated with like very, long-standing medical colleges and nursing schools, etc. With that being said, I also need to make clear is if you work in companies, some big companies, they offer also they can offer you medical insurance, and it depends on, of course, on the coverage level, etc. They have levels depending on your position, etc. And now the country is moving toward pushing all those who work in private sector to offer all their employees medical insurance.
That's interesting.
So that's why it's confusing. We have both systems.
Right. Well, and it's also interesting that here people are complaining about health insurance and pushing for a private, a lot of people want a private answer, a government answer where everybody's sort of covered, at the same rate. And there you have that, and you're moving towards medical insurance.
I don't think we're moving, but I think
it's becoming more prevalent.
Right. I think it's because of the high load that the government hospitals are facing, especially from those who are not covered under military hospitals. We have many military hospitals, big hospitals. So the load for the other citizens will fall onto some big government hospitals where you will have to wait sometimes months, sometimes years to do procedures. And I think one strategy is that the government is trying to support more entrepreneurs to open private hospitals, and then we will help you paying for insurance. Just make sure that everyone has at least an option, and so they don't have to wait months and months for the government.
Right.
You know what I mean?
Yeah.
So you will still be entitled for the government service, but instead of waiting, you can still have other options.
Okay. Now, what about the standards of care? Did they vary between there and here, or were they pretty similar?
Right. Many hospitals in Riyadh and in Jeddah, the two main large cities in Saudi, and the east in the east coast, we have another two big cities. Most of the hospitals there are JCI accredited. I think Joint Commission accredited most of them. So I'm assuming most of the hospitals follow the U.S. standards.
I see.
Specifically the military hospitals. Surprisingly, a lot of them worked or collaborated with United States developers. Like, so for example, in my case, in my hospital, they collaborated with some companies from the U.S. early on to establish those standards, even in terms of equipment, etc.
What about in diabetes specifically? If you're diagnosed there today, what happens? You don't get regular and MPH insulin. You get modern insulins, right? Like some version of Novolog, Humalog, that kind of stuff.
Correct.
Right. And do people start off with injections? Because I get a lot of letters from people living in your area asking if I know how to get CGMs and insulin pumps there. That actually happens frequently. Are they not readily available?
They are, but again, I would still consider. Well, it's very important to mention that still services are mostly and like heavily provided in central areas or big cities. So maybe you will hear that from residents of rural areas or areas far away from the central areas or from the large cities in the kingdom. The other thing, I think, yes, it depends on where they are from, or they're depending on the supply, or if they got those new equipments. I also noticed some people are a little bit afraid of the pumps. In my family, a few of my cousins actually have type 1 diabetes, and two of them, actually, their parents are not very comfortable having the pumps, so they still prefer the injections. But they're here, they're offered, and I think it's based on preference.
Yeah. I actually know a few families that fly to America, buy products in cash, and fly back. And maybe things are changed since even I've heard those stories. I mean, it makes sense too, that as you get further away from population centers, care, I don't know if it slips or if maybe just the ideas haven't gotten out because there's fewer people and, they don't get a chance to see each other using them. I would also wonder how you keep insulin cool there. Like, yeah,
they will. It's same thing. Same thing applies to the US in the summertime. They will always move with their small refrigerators with them.
Okay. All right.
But we don't do lots of summer activity in the summertime. So unlike in the US, for example, in the US, you would be worried, right, about kids going camping or going for the beach or going for sports. Very, very limited things we do outdoor in the summertime. So they're always in the refrigerator.
I understand. You guys need some trees.
But yeah, referring back to the pump, I also don't want to give wrong information. There might be other factors that I'm not pretty aware of. So yeah, I'm just just want to be honest enough. I might not be very familiar with all the other factors.
Okay. No, I appreciate that. I'm just interested in your perspective. So when you get your PhD, I guess that kind of drives your focus moving forward. So you come home. Was it always the plan to come home and practice?
Yes,
it was. So you come home with an eye on helping with the cognitive issues, and you're in this one focus right now. Is that right? Or do you move outside of it as well?
I move a little bit outside. Like, for example, lately, actually, Julia specifically inspired me to look at that variable where transition, specifically that we don't have transition clinic. The transition clinic by itself is a new idea. In some specialties, they started applying them. For example, in rheumatology, they already have transition clinics to treat kids who are moving from childhood into adulthood. But for type 1 diabetes, despite the high prevalence here, they don't. And what's also concerning to me compared to the US is that we consider children as to be treated in the pediatric clinic if they are from 1 day old until 14 years old only. Unlike in the US, where they can continue with the pediatrician until they are 21, if I'm not wrong, or 24.
You can actually stay with if you're in college, I'm sorry.
Exactly.
Yeah, if you're in college, you can stay with your pediatrician until you've graduated. I'm sorry, you broke up.
Right.
Sorry.
No, and here only until 14. Once they get into puberty,
Arwa, you just disappeared. I think we lost our signal.
Yes, I'm back.
Hi.
I'm back.
Did the dog get you?
Yes. Yeah. I'm okay now.
No, it's fine. You're super clear.
So yeah,
don't worry.
So that was concerning to me because I was wondering what happened to those kids. Do we just send them to the adults area starting from 15 years old? How about if they're like, even if you were considering them physically at puberty in terms of mental or cognitive, or you don't know yet, even deciding who's mature and who's not takes a psychologist to review that, right? So they just, at 14 years old, they just discharge them from the pediatric area and they send them to adult, where everything is different. The approach is different. The provider is different, and the family should not be involved that much, and all that has an influence on their compliance.
Can I ask a question?
So,
is that cultural, that age cutoff, or is that like?
Yeah,
it is.
It's because I'm not sure if you're familiar. We consider for a boy who's at puberty or a girl who's at puberty, they're considered already matured.
Oh,
so you have to for a female, she has to cover up from other male who are not from her family, and for the male, he cannot be with other females who are not among his family, or they should cover up.
I see.
So in that case, we regularly admit them in pediatric units. Of course, that was mostly before we had shared rooms, etc. So usually the sitters or those who are admitted with the patient are usually mothers. So for this patient to be a boy at puberty, it was very inconvenient. So usually they put that cutoff limit. So it's for segregation purposes, to help segregation mainly.
Make sure I understand.
And it continued.
Yeah. Make sure I understand. If my son was diagnosed right as he hit puberty in that age, then my wife could not go with him to the hospital because there'd be a commingling of genders in that
they
scenario?
Could. No. It's just for admission. For admission, usually for convenience, but no rule to prevent anything. No,
okay.
They can still go and do everything together. But I mean, for convenience purposes, they organize it that way.
So this one cultural idea leads to separating, like putting children into adult care, something that's really confusing that they're probably not ready for, because at that age, I mean, I have to be honest, at that age, I was like stupid. I didn't understand anything. I had no context for anything still. I guess I didn't grow up where these kids did. So maybe I would have been more mature at that age. I'm not sure. But that's incredibly interesting. So you said that the care differs between the segment of children and the segment of adults. How does the idea of care change?
Like, for example, consider how the care in pediatric clinics, for example, is always family centered, right? you're not gonna be able to access the child without his parents, and in most of the cases are usually mothers. But now with moving to adulthood, your family are not really the focus. You are the focus. Now should be all of a sudden the one who is taking care of all the details, including scheduling and compliance, and not only administering your medication, but following up all these different appointments and supplies, etc. So the approach is different. Now you're not only communicating, you used to communicate with the whole family, but with adults, you mostly communicate with the patient.
How does that work?
And then the other thing,
say
that again.
How does that end up working out? Like, is that a
okay,
rock solid plan and everybody's doing really well and super healthy, or is it problematic? Somewhere in between?
It's actually a very good question, because when I came back and I noticed that I communicated with some of the endocrinologists we work with, the pediatric endocrine, and they told me that they tweak a little bit within the system just to keep their patients with them until the physician feels very comfortable discharging the child from pediatric to adult. Which is to me it's a nice, but at the same time it takes a lot of effort from the physician side to
assess the kids, right?
Yeah,
and figure out who's
assess
ready.
and they still have to compromise a little bit, and talk with sometimes admin people or hospital admin people, because they keep pushing for that. Like, you have to move this child to adulthood. He's already in the system. He's 14. You need to move him to adult. But then they will go and a little bit advocate for their patient to just keep them under their care until they feel comfortable.
I see.
Making sure that the child started to be independent, start administering his medication while following up, his coming at least to the clinic sometimes alone, etc. And once they feel they're ready, they transfer them. But it's not always possible. Sometimes you will have to do that.
What are A1c goals there?
I don't have an accurate number, but I'm assuming.
Well, what would you ask what would you hope someone was aiming for? If you were,
I would say 6.5. I would say.
Okay.
6.5.
Is diet there? Are there any cultural differences in foods that make type 1 management easier or more difficult?
I would say yes. It would make it more difficult just because the culture or the lifestyle here is sedentary a little bit, because especially the weather. Mm-hmm. People are very reluctant to go out with that weather, especially in the summertime. And summertime or summer weather specifically coincides with the summer vacation, which is quite long. And not all kids get to travel or do activities. Most of them are indoors. Gyms and to participate in a gym or something indoor usually costs money. It's not possible for all families to offer that for all their kids. So I would assume the diet with all the options we have, people like dessert here, people like variety of food. We have very now the fast food thing is becoming an expertity here. Like making all sorts of U.S. fast food, but now we no longer have chain restaurant, or we do, but we're becoming very good at making our own local restaurant for fast food, and especially kids that they're adolescents are, they cannot resist all these options, especially in the summertime.
Wow.
So I'm assuming it would be a little bit difficult. Yeah. I personally noticed that when I came back, people eat lots of snacks, unhealthy snacks here compared to in other countries where snacks are limited. Here they have a lot of options.
Well,
It's very tempting.
yeah.
We're very, very good at making dessert here. Very, very good, like insanely good.
You're welcome, by the way. We've exported all of our best goods to you to learn from. McDonald's, congratulations. That's terrible. Can I ask, just from a personal standpoint, what is there anything you miss about the U.S.? Either professionally or personally?
A lot. I miss a lot. I miss the weather. I miss the green life. I got very attached to the lifestyle where I do go out during the summer all the time to parks, mountains, lakes, rivers. I miss all this, to be honest with you.
Yeah.
I miss the diversity very much. I kind of got addicted to it. So now every time I go out or socialize, I get bored very quickly because people are mostly the same here. They're from the same culture, from the same place. We don't have a lot of, we don't have a strong immigration history. We do have expats coming to work here, but not immigration per se. So people don't end up mixing and being just one country. No, we still have a lot of people coming to work, but not so much mixing, and unless you make active effort to do that, which I ended up doing. I ended up joining meetup groups as if I am still in a new country, just to fill that need of meeting new people or diverse people every time.
That's interesting. I guess you ask a question, and once it gets answered the same way 4 or 5 times in a row, it's not a lot of excitement about asking it again.
Exactly.
Yeah.
Exactly.
Right. Well,
yeah.
that's
it was always interesting here to conversate with people, and you always see different religion, different culture, different ethnic background, or different interests too. Like people here usually do the same thing. Like majority of people are kind of similar, and even we're very social oriented society here.
Yeah.
We still like to fit in, and it's now it's changing at least, but still, like the overall picture is that everyone looks the same, talks the same, does the same thing, and so on.
You made me think of earlier, you kind of had a light bulb go off in my head when you said people are either at home or in the mall. And it reminded me of a time I visited the Dominican Republic, and there was this mall, and it just felt like everyone was in it. It was the busiest place I had ever seen in my life. And it never occurred to me that it was about getting out of the hot weather until you just said that. And the idea of diversity, that's not going to change there anytime soon, I would imagine.
It's actually changing in Riyadh, specifically in Riyadh. Riyadh now is becoming like a very big hub for all new companies and new investments, and with most of the vision of 2030, all this is they're attracting more businesses to open in Riyadh. Mm-hmm. So a lot of people coming to work in Riyadh every year.
Oh, that's great.
It's interesting. Yes, it's very interesting. Compared to before, now I see more and more opening up. If you go out now, you see a lot of people from different places going out more. Before, with COVID and all the travel restriction, people would come work and then they travel. You would rarely see them coming out in the weekend or coming to entertain in Riyadh. But now with the COVID restriction, I came to realize how much diversity we have in Riyadh, because now with all the travel restriction, people ended up spending their weekends here or spending their vacations in Riyadh. So you will start seeing people from different countries and places in Riyadh.
And some of them are actually immigrating.
And I think it's going to get even more diverse, because the plan is to have more foreign companies opening their headquarters in Riyadh. So I'm expecting to see more and more.
That's exciting. That's probably particularly exciting for someone like you who's lived somewhere that's more diverse.
It is.
Yeah.
I'm enjoying it very much. it's true, you don't see any changes at the level of the society, like comparing it to people who would be living here for years and years, changing even the like building block of the country itself. But you will still start to see changes, people opening up more now and being more accepting of differences, or now you don't have to do active effort to look like everyone else, because you will start being more welcomed and accepted the way you are.
I see.
So I'm enjoying it for now.
Yeah, I would be excited. Are you married? I didn't ask.
No, I'm not.
I have no idea what's happening right now. Hold on. Well, Siri just started talking for some reason. That really messed with my head. It hasn't happened in a long time.
Maybe she wasn't happy with the question.
Yeah, I got to try harder. I
Marriage question.
I couldn't hear with my headphones on. Do you think my speaker just started going like, "Come on, buddy, try harder"? No, I just was I was just interested. So is that something you're interested in?
What, marriage?
Yeah. Ooh. Is it uncommon for you to feel that way at your age living there?
It is mostly. Most of the people in my age are married and have kids, including whether despite of the gender. But I think, especially living in Riyadh, again, I will keep pointing back to Riyadh, is because even in Riyadh, not only becoming the hub for all the new jobs and for all nice career pathways, people would move to Riyadh from different cities, even in the kingdom. So you start meeting people at their 30s who marriage is not in their priorities, because career is their priority mostly. So now it's becoming common that you see people in my age who are not married and they're okay. They're not desperately looking for it, or they're not facing pressure from the family to get married. It's becoming normal, just another normal. I think it's mainly because of career. Most of the people I meet who are in my age and are not married, they're always very passionate about their career, what they're doing.
So it basically breaks down some lines, like you're going to build a family or build a career, but those two don't mesh well together. Like the idea of two really career motivated people living together doesn't happen quite as much.
No, it is,
but not for you.
But I think it's very interesting. If we will start talking about this, I will be talking for like a few more hours. But I think what happened is, with this transition, the sudden and quick changes that happened in Saudi in terms of society and economy. Of course, economy has been okay all the time, but now there's major society changes. For example, now we're driving, before we didn't, and all the breaking of the segregation that's happening now in many places, etc. So there's major dramatic societal changes. What happened is, in those under 30s, they're in between. They're not from those who are before the generation who are older, or they're not even the current generation who are already experiencing these changes, that they don't feel anything different. For us, or people in my age, we're facing lots of conflicting ideas. We continue to compare what we see now compared to what we've been taught, or what we've been used to do, or what we've been prevented from doing, etc., compared to now, where everything is different. Yeah. So I think what happens is, those who cope very well and adjust quickly and fit in, they need to find someone who's similar to them, who's adjusting well and adopting all those new changes without feeling any conflict, any internal conflict. And here comes the problem. I think girls are doing much, much better in this compared to guys in our age, where they still not sure if they like what they see now, and if they're okay to completely adjust to what they see, and they're still stuck to some old ideas or old about gender, about what to expect from a wife, what to expect from marriage, all these things.
Well, does that
so I think I'm in that
space,
in that gap, in that space. Yeah.
Oh, well, I mean, listen, it makes sense, right? Because when human rights and civil rights and things like that get more and more available for people, it really does end up benefiting women exponentially, right? Right. Whereas men are like, wait, so then there's no lady that's going to clean the stuff and make me food. Like, you don't get quite the same deal if you're on the other side of it. So that makes 100% sense. And so people are holding out. They're like, I wonder what life could be. I'm going to wait and pick something cool. Right. Yeah.
Yes. Yeah. Some of them are actually waiting.
I don't want to be stuck inside in the air conditioning. Watching this guy's socks.
A lot of girls in Saudi now, they don't want to wait. They feel that they spend so many years in that old mentality, and they don't want that anymore. So they're very eager to live their life to their maximum capabilities and maximum potentials, either at work or even in social life. So they always have plans. When I meet girls in my age, it's very surprising and interesting, because most of them are in the same page. Most of them, they just want to enjoy all those privileges that we have right now. You can travel anytime, anywhere. You can do any hobby that you wanted before and was not an option. For example, music, playing instruments. You can only do that at your home or practice it with your family, but never something that you can work on or have it as a career, or something that you can make business out of it. Now, everything is just all of a sudden open. It's kind of distracting, even from looking for a marriage, believe it or not.
You know what it sounds like? It sounds like Netflix for life. Like, there are so many options that you just scroll and scroll and scroll and never watch anything. You're just like, there's too much to do. I can't pick. But that makes sense, though. And it kind of sounds exciting. What do you think started that kind of boom? Was there one cultural shift that moved everything in a different direction?
I think there are so many. But for example, I'll give you a very, very simple example. Some of the I think King Abdullah, previously he was Prince Abdullah, and then I think I'm not sure if you're familiar with all the royal family members, but King Abdullah, for example, he started a move that was, I think, about 15 years ago, where they started the studying abroad program. They created a program where they sponsor students with high GPAs, starting from when they finish high school, and they sponsor them for studying abroad programs in different countries. Started with the US, Canada, UK, and many others, but the three main big countries that we used to go is the US, Canada, and the UK. It started a long time ago, about 15 or 20 years ago. I think the plan from what you see, is that they wanted to prepare a generation of people who are, let's say, Western educated. They're used to seeing different cultures, because think about it, we've been a little bit introvert for some time in terms of exposing to different cultures, different races, different religion. So I think the plan is to not only make them get Western education, but make them mix with other cultures or other religions, and then when they come back, they're more ready to absorb the new changes or that are already happening. So I think that worked for big part of what's happening, because those students, when they came back, most of them now are the leaders in most of the, let's say, ministries, all the like government services or the big companies in Saudi Arabia. So I'm assuming that in part worked. And then, of course, the new prince, Mohammed bin Salman, with that of course, that's the first and the only time we ever had a young leader, young leader. And that kind of changed everything because he is, I think he has courage to change things that others were very reluctant to change. Just they were very afraid to change those social things that were
and now
thoughtfully, thought about it as religion when in fact it wasn't.
Right.
So I think he was just courageous enough to start pushing for those changes. That has been already there, but no one has the courage to apply them or implement them.
Right. I have to admit, the first time that I saw in the news that it was a big deal that a woman was driving a car, I stopped me for a second and I thought, wait, women couldn't drive cars? Like I didn't, that was not something that even occurred to me, but so it's kind of fascinating because you're transitioning, but that transition still has to happen culturally and slowly to some degree. Like you can't, I imagine you can't just, like if you could just magically flip a switch and move everybody into a different space, it would probably short circuit most people's minds, right? Like it's that different from what they're accustomed to and what they were expecting growing up. Wow. That's fascinating.
Yeah, but because lots of people don't realize that, just give me a minute.
No, you're fine. Do we have to shoo somebody away? Gvoke HypoPen has no visible needle and is the first pre-mixed auto-injector of glucagon for very low blood sugar in adults and kids with diabetes, ages 2 and above. Not only is Gvoke HypoPen simple to administer, but it's simple to learn more about. All you have to do is go to gvokeglucagon.com/juicebox. Gvoke shouldn't be used in patients with insulinoma or pheochromocytoma. Visit gvokeglucagon.com/risk. Next time you're out on the internet, type Touched by Type 1 into your browser and go see what they're up to. touchedbytype1.org. Now I'm going to get you back to the conversation.
Yeah, my brother is just looking for my car keys. So yeah, it's people don't realize that we didn't wait for driving to start developing very quickly.
Or where you broke up, are you back? You're not back. Tell me when you can hear me again. Hello? Hello? Oops. Hello?
Or
Hey,
mixed environment.
I'm so sorry.
Night shifts.
Hey, I got to cut you off. You were gone for about 20 seconds. So I apologize, but the last thing I heard you say was it didn't just happen with driving.
Yes.
Yeah. Okay. I'm sorry.
Yeah. So I'm saying it didn't just happen when we started driving, but it started very long time ago. We had women working in businesses, in medicine, in academia. They're deans. They're working everywhere from very long time ago. My mom was one of them, and then driving was a very, very minor compared to what we were empowered to do long time ago. What was going on is that for some reason they associated driving with some religious restrictions, which wasn't a right connection. It was never a true connection that was made.
Right.
It was very easy for it to stay there, don't touch it. Okay, that's fine. Just keep it. It's not really preventing us from doing anything.
Mm-hmm.
We can still study, we can still travel, we can still go to the US and do PhD, we can come back and be prime ministers, etc.
Yeah.
So it was never a barrier. But
if I had to guess,
so yeah.
Arwa, if I had to guess, it sounds like one of those things that men who wanted you to wash their clothes and make them food thought, oh, if we start letting women drive, they're going to get out in the world and figure out it's not as much fun to do my laundry as I told them it was. Doesn't that have like sort of like that just for like the idea of if you restrict somebody's travel or their ability to see other people or interact with other people who have different ideas, then you restrict their ability to dream those things. And then you can kind of, it's easier to control them then, I would imagine.
Yeah,
yeah,
of course. Yeah. Although we it wasn't just about like washing the laundries. It's more like, it's more deeper than that. But yeah, it's 100% true. I still meet people or conversate with people who would still feel threatened by having their wife driving.
Mm-hmm.
For the same exact reason, although they won't admit it. He would tell you, "Oh no, I'm afraid it's too crazy out there. People don't drive nicely. Oh, I don't have money to buy another car." They will use all these other excuses. But if you start pushing and pushing and pushing, here you come to this true idea behind it is that it's a threat.
Yeah. You get frightened that people will see a world and think, well, this is better than the world I live in, and not come back. I mean, and when you're so accustomed to that being the truth, I mean, giving it away, if you look at it from the male perspective, like just giving it away must be difficult. I mean, I'm 50 and in America, I became a stay-at-home father in my 20s. It was incredibly uncommon at that time when I did it. And it was looked at unfavorably by most of the older people in my life. They mostly looked at me like, oh, he's taking advantage of her and he should be working. And they didn't understand that we thought that this was the best balance for us, and the way we could make things work. And I will tell you that there have been times when I'm growing up where I think I love the way my life worked out, but you do wonder sometime, like, what was it like to, 1950s America come home and have a bunch of people just treating you like a king walking through the door? You know what I mean? Like that's never happened to me in my entire life. I don't think I would want that, but might have been cool to see it one time just to see what it was like. My example about the laundry is because I'm the one that does the laundry at the house and I want to get away from it.
Yeah.
I hate doing the laundry. But that's not the point. The point is that you guys are making these amazing leaps. And are they transitioning, I would think, not just into medicine, but everywhere, because you're getting new ideas, people who've been exposed to more. I mean, you might well see a real renaissance.
Right. Actually, with medicine, medicine started to advance in the country way
prior.
Back. It was actually one of the few specialties that the country didn't really, or the country sponsored all endeavors related to medicine from the early ages of this country. So that's why if you compare hospitals in Saudi Arabia, specifically Riyadh, compared to the other Middle Eastern countries, even other Gulf countries, we have some of the best physicians and hospitals. I'm not saying this because I'm Saudi, but this because really it's true. They spend a lot of money in this. The country invested a lot. Most of them are prepared either in Canada, Germany, UK, US, and most of them, they spend their fellowship there. We're still collaborating with big hospitals and big, I'm not sure how you call those kind of companies, but those who develop hospitals.
Yeah.
We have a lot of ongoing businesses that started decades ago.
Yeah, they're like private for-profit hospitals, right?
Exactly.
Yeah. Well, I just had a question on the tip of my tongue, and it just fell right out of my head. Damn. Shoot. Where did it go? Where
So
did it
you're
go?
asking about the transition?
Yeah,
If
I'm
they're
sorry. Yeah,
transitioning?
I blanked out for a second. But yeah, the idea I'm wondering about is, will, like, at what point do we see the information that was brought back to other places, refined by other places, and built on top of? Like, that's because I don't think that diabetes care in the US is particularly finished, right? It's better than it was, but you can still go to plenty of places who are operating like it's 10 or 15 years ago. And so my expectation, well, I guess it's my hope, is that diabetes care will become more two-way, meaning people won't go into doctors' offices and just be told, do this, do this, do this, and then you come back and we'll measure it again later and we'll change some things. Like, I want to see people in a position of power, in a position to say, I'm going to make a change to my basal insulin, or I'm going to come to realize that this meal needs more insulin than this other meal, and not just use some carb ratio and just, let my blood sugar be high for 4 or 5 hours afterwards. And I'm wondering if this spreading of information won't in time lead to people understanding that better. But I mean, do you think people understand that they need to be more proactive with diabetes care? Or do you think that understanding exists some places and not others?
What's good about type 1 diabetes specifically, that it's affecting unfortunately, at least considering that the prevalence is increasing with recently compared to before, I think it's affecting the new generation, who are very, let's say, first of all, they're tech savvy, most of them. They are being raised differently than kids before. So most of them, they do things because they want to do it. They need to be convinced. You cannot tell them what to do anymore. You need to convince them why they need to do things. This type of mentality or mindset will make me think that it's possible. Yeah. Because you see them now. I interact with a lot of let's say school age kids to adolescents. They're very mature compared to when we were at their age, and they're very independent. They're given more opportunities to practice their independence compared to us back in the days, specifically girls. For example, I was never allowed to go to appointment alone or everything. My mom would be very worried, so she preferred to go with me. Now they do everything alone. Yeah. So I think this will facilitate the implementation of like self-care, all the principles of self-care or individualized care. However, what I think still might be a barrier is the approach from medicine itself. Yeah. I think healthcare providers are not confident enough that those kids are able to do that, and that's why they maybe insist on depending on the parents. So that's this age generation difference where you as an adult don't think that they know enough, or they don't trust them enough. But unless if we start adopting this new mentality that no, this new generation is able to do it, just simply because they are raised differently. They've been allowed to experience everything. They've been allowed to do things alone, so they are stronger than when we were at their age. So I think the change needs to start from that provider itself.
Yeah, it's exciting, isn't it, to see a generation of people who are less restricted than the one before them, and to see what they kind of do with it. And, obviously everyone doesn't take it in a great direction, but some people really do. And that idea of self-care for medicine really translates to self-care for a person in total. just their ideas and their goals and their focuses, everything is within their control, I guess, and no one's telling them what to do with it. So they're able to explore directions, and people are going to find lives that they just never would have been able to find in the past because they felt so. I mean, it's not even that you just felt so much, but your parents were scared, like you said, and they would instill that fear on you, whether that fear was safety or religion or government or whatever it ends up being. And, you can't do that, or we don't do this. We can't say this. We can't go here. I mean, you can't play a flute outside of your house. And now that just, I'm super excited about where it's heading. I think this is a very exciting generation of people to pay attention to. I've always thought that. I was interested that you said it too. So
yeah, they're very, very, very self-determined for their age. Honestly,
yeah. No, it's crazy. My daughter could be 35 if you talk to her, and she's
exactly.
Yeah, she's 16.
Yeah. Like if you notice, especially now these days. For example, I have 3 brothers. One of them is 40. Of course, they're all adults, but they all can spend time with the friends from all different age groups. Like they all together, they have 10 years different from each other. Yeah. But when they gather with their friends, they have friends from all age groups, and they enjoy their time. They travel together. They do things. And I'm like, wow, before we didn't do that. We would stick to people at our age.
Yeah.
Even for me, when I gather with my family, we can spend hours and hours conversating with 16 years old, and you would never feel that she's only 16.
I interviewed 3 girls who were like 13, 15, and 17. I interviewed them together. They're these 3 friends who live on this island together, and they all have diabetes. So I was like, I'd never done an interview with that many people before, and it felt like hectic to me sometimes. But when I got to the end, I thought, that's crazy. I could be their parents. And we just had a very normal conversation. It was just, It was fascinating. 3 girls taking care of their diabetes at 15, I think 16, 17, like whatever they were. They're young, and they just didn't come off as young. Like, don't get me wrong. They're still, they're a little giggly sometimes, and, they maybe don't follow sarcasm as well as an older person would or stuff like that. But they have they know who they are. I guess that's really what it ends up being, is you ask them a question and they know the answer because they're connected to themselves. They're not just these robots that their parents are controlling through life. They're autonomous people, and it is absolutely lovely, really great.
Right.
See,
again,
go ahead.
Going back to the transition, I think maybe they are better off compared to other generations. But I think still right that the purpose of transition clinics sometimes is really not only for the patient himself, but really it's for the provider to prepare for this transition, because we don't have somewhere in the middle. We either have a pediatric who's very nice and who will involve the whole family, and then all of a sudden we would have an adult endocrinologist who's used to older people, and he was just ask specific questions, and he's not going to dig deeper with the patient and just tell them a list of things that they need to do, and then they just go home.
Yeah, that's a shame when that happens.
But for this specific generation that we just said, I think physicians, or let's say providers in general, whether physician or nurse practitioners, they need to be prepared to trust them, or at least to be able to assess those kids from different standards or standpoint, not just use our own ideas that, they're young by default, we shouldn't trust them, or by default they shouldn't be controlling their condition 100%, etc.
Yeah, I mean, there are people who are able to do things that their age wouldn't indicate sometimes, and those people shouldn't be left behind, because you're like, oh, well, they're 13, they don't understand. I've had kids come on this show that are astonishingly good at taking care of their diabetes, and they're young. I have one coming up soon, a girl living in Russia, and she's young and found the podcast on her own and figured everything out by herself. It's fascinating. Like really, really cool. And I think that shouldn't be taken from people. Like, everyone's not going to get it on a deeper level, but everybody should have the opportunity to try. That's, it seems like the old way of thinking about it was, most of you aren't going to understand this, so I'm not going to bother explaining it to anybody. Answer my questions, turn the dials, use a little more here. That's it. It's, and now there's glucose sensing technology, which just opens your eyes to what's really happening with your blood sugar. It's fascinating, amazing. So what is your goal? Like, what do you got all this education, you came home, you're living a different lifestyle in Saudi than probably, 2 generations ago if your family did. What are you going to do with everything you've amassed? What is your hope?
Okay.
It's a big question.
In terms of career, it's a big question. It's a very big question. And then it also keeps changing, I think, because sometimes what you come back hoping that you want to do is really not feasible, or probably not. I'm not going to say not possible, but might take you years and years to even do 10% of it. But I think what parts of resilience mean is, even your goals, you need to keep modifying them, not necessarily lowering your expectation of yourself, but no, maybe you now have a better perspective of how is it really going on here. Because I may had ideas about what I want to do, but when you come here and experience life here, or the flow of things and what exactly needed, you might start realizing that there are other areas that needs to be worked on as compared to what you had in your mind.
Sure.
Or instead of this one, this is more important for the country at this time specifically. So this is what's been happening with me. I've been trying to find the right way to reach, or not reach, because I don't think there should be one goal that you reach it and then you're done. No, it's always changing depending on the need. So the plan is, when I did my PhD, I focused on cognitive functioning and how it affects their school performance, and then eventually their chances of getting accepted in colleges and then getting good jobs for patients with renal failure. But now I'm trying to expand it more on other kids with chronic illnesses. Because what happened, especially with renal or children with renal failure, although it's considerably a rare condition, especially in developed countries, it's still the focus in their care is mainly stabilizing them, physiologically at least, or maintaining, is at least to stay alive, and decrease mortality, decrease morbidity, etc. But their advancement in career or in schooling is not a priority at all. Which is, I understand why it started like that, but I also don't understand why it continued. Yeah. Of course, initially, you would just want to make sure they survive, right? But then eventually, what? Is it just make them survive, but how about their quality of life? How about their opportunities to pursue their life goals without affecting their economic status, etc.? So that was my plan, is to go back and dig deep in the system and find out those gaps where those kids sometimes just don't go to school because they get admitted quite often to the hospital. So the family feels the burden, and then they stop sending the kid to school. So those kids will not be able to catch up with the schooling system, right? And some of them don't end up never going.
They just stop advancing, right? So you just end up being as mature and as your age of when you're diagnosed with something. Like, it's almost like getting sick ends your life instead of
Exactly.
right, instead of figuring out a way to incorporate it into your life.
Exactly.
Yeah,
Even sometimes when they get the kidney transplanted, the new kidney transplanted, they still, because of fear from getting infection, etc., some families don't send them to school. Of course, we don't have such a rule where they can be, where they, where they can be referred to child protection services due to that. It's still not technically considered a neglect. We do have child protection service, but like not send them into school per se for a chronic condition is not really something clear cut,
I see.
So yeah, sometimes out of fear, they just don't send them to school, and it continues being a problem. So this is where I started developing the research ideas.
Mm-hmm.
Why and what can we do to prevent that? I heard when I was in the state, I heard that they have some tutoring programs where they can come to the child during his dialysis session and offer him some schooling, etc. We didn't have that. We don't have that yet. So my hope was to create this program where it can be a collaboration between Ministry of Health, Ministry of Education, where we can have a whole program established for children with chronic illnesses, in which they have regular follow-up, regular cognitive assessment, psychosocial assessment, and it's embedded in the education system for these kids.
Yeah.
So they can sign up on this program once they are diagnosed. So we track them early on. We identify any limitations if they have specific problems with math per se, just due to, for example, anemia, maybe with renal patients, for example.
Okay.
Maybe they will have specific problems with memorizing due to anemia and poor memory, etc. Do we recognize that? Do we have that into consideration?
Right.
If yes, how and what we're going to do about it? It's unfair that those kids are being treated as normal kids, or they have all the right to be treated as normal kids. But I'm afraid that sometimes we will miss some limitations that are specifically to their condition,
Mm-hmm.
but we don't know.
Yeah, so that
we don't do anything.
So they don't become disposable, and you don't just see them as, oh, they've got an issue, and now that means they shouldn't enjoy the same ideas that everybody else gets to hope for. It's just
Exactly.
It's amazing. It's beautiful. So you keep bringing them. The idea is to keep bringing them services that keep them up to speed while they're taking care of their health.
Right.
Yeah, it's so simple, right? Doesn't it just make sense?
It does. Yeah.
People should not be.
It does. But as I mentioned to you, when I came back, I realized we have other gaps that should start before that needs to be fixed before we start implementing such programs. For example, we don't have school nurses yet.
Okay.
So when you first think about such a program, right, you would think immediately of the school nurse who will be doing the evaluation or the follow-up for this kid, at least in the school, right? Who will be going to do this, for example, cognitive assessment or these regular assessments. I was hoping that this can be implemented in the school system. But if we don't have a school nurse for a specific school or for at least specific district, then who's going to do that?
Right.
So this is where I started realizing, okay, let me modify my goal and start looking for like other things related to that to see where the gap is, where you can start fixing the issue is.
Is it crazy to think that school nursing could become a thing? Like if somebody got behind it, would there be a way to get it funded and
I think the funding is just what's preventing it. It's as a law, it has been issued 4 years ago.
I see.
But now each hospital needs to have a school nurse. Implementation, not yet.
Yeah.
And I think mainly because of funding issues.
Yeah, you really do have to jumpstart things. They don't just either things start out of necessity or they start because someone who has the ability financially gets behind an idea and moves it forward quickly. There's no other way that things begin, really.
Exactly. And you know what's the major problem here is the lack of data. Unlike in the US, where already well-established research data are there to support your
ideas.
Let's say, to support your ideas or to support your proposals for health policy changes, etc. We still don't have that. So that's why you come to realize that, okay, I need data in order for me to come and approach decision makers or leaders in the healthcare sector where they have a lot of huge priorities to come and tell them, you know what, stop and fund school nursing system. First question that would come to mind, why now? Why is it urgent? But if you have the data and if you can show that this is exactly what's going on, those kids might be facing additional difficulties making families, additional difficulties finding jobs. They just can't. They are not allowed to make good GPAs, basically, just because of how their condition is. So this is my hope, starting from the basics and trying to establish some database.
Well, I hope you are able to figure out a way to make it happen, because it's obvious while you're talking to me, like it makes me feel this way. It's obvious why things take so long to come together, right? Like it's clear. There's so many moving parts and so many people that you have to talk into it. There's money that has to be raised, and you have to actually do the physical thing. It's not enough to just have a great idea. You actually have to accomplish it afterwards. And then it takes time. Then you imagine, then you bring in the school nurses, and some of them you hire suck, and then you have to be replaced with other school. It takes time to get it working smoothly. And
exactly.
And we all don't have that much time. Like, we're all just like, hey, like my kid's in school for this long, or my life is only this long. And then people get frustrated that things like that don't exist. And that frustration can sometimes end up
killing your motivation.
Yeah. It just takes away your drive. You just think, oh, I'll never get this done. I might as well go do something different. And you need people to do those difficult things and have those fights. So,
right.
Yeah. So you might as well be one of those people. Go get them. It's got to be, somebody's got to do it. Somebody has to decide. This isn't, listen, it's a much different scale. But when I began this podcast, I thought, I'm going to talk to people about diabetes the way they need to be spoken to, and not the way that the establishment says is okay. Like that just needs to start there. Like, we can't just keep telling people, oh, it's okay, you're fine, you're doing great, don't worry about it. Meanwhile, they're having all the problems that come with out of control blood sugars. And then they're being told by somebody, don't worry about it, when they could have gotten actionable information that would have helped them maybe pull things together a little better. And instead we were, oh, we don't talk to people like that. That's dangerous. You can't tell them. I'm like, you can't tell them how insulin works. Like, shouldn't we at least understand how insulin works? How many people don't understand how to pre-bolus a meal? It's never been mentioned to them ever. And they have diabetes. It's crazy. So I just thought, well, I'm going to do it and we'll see what happens. So sometimes you just got to leap, because trust me, there were people telling me not to do it. Established ideas were very much against it. And I had to fight through many times of people, speaking poorly about me behind my back, or sometimes to my face, and telling me that I'm doing it wrong. And I was like, well, you can do what you're going to do, and I'm going to do what I'm going to do. And it worked out very nicely. And I hope you have the same kind of a success.
Yeah. What's your background, if I may ask?
I have no background what to speak of.
Educational. What's your specialty?
I know you do, and I don't have any background. I graduated from high school. I went to work in very blue collar jobs.
Okay.
I met a woman who was nice enough to recognize that I might be more than my station, if that makes sense. We made a family. And my second child, our daughter Arden, was diagnosed with type 1 when she was 2. I began using the skills I had writing to write about it online when she was 3. And about 7 years ago, after developing, I don't want to call it a system, but developing a way of managing blood sugars no matter what you're eating, and keeping A1Cs, my daughter's A1C's been in the 5s for like 7 years. And she has just no diet restrictions. And it's because I fundamentally understand how to use insulin. So about 7 years ago, I started this podcast. And I began.
Oh, this podcast is 7 years old?
It is 7 years old, yeah. And it's been heard, it's been downloaded. I think we're up to about 4 million now. And it's all over the world. And if you go to, just as an example, the Facebook page for the podcast, you will see people constantly all day long, either sharing their struggles and helping each other or sharing their successes and motivating other people. It's really like astonishing, and it just was. And I will honestly tell you that on day one of this, somebody established in this community told me, you can't do this. Do not talk to people like this, that you can't tell people this stuff. And I was like, well, I think I can. And I'm going.
It's not a secret. Yeah.
Well, it is a secret because people are scared to say anything that isn't concrete about diabetes. And I believe that people are smart enough to hear nuance and apply it to their life. Crazy me.
Right.
Right.
So, yeah. What's the problem with telling people that is not concrete? Now, after COVID, everybody knows that nothing is concrete.
Yeah. Right.
So I think people are, again, you know what, Scott? I really think it's the old mentality that younger generation are fragile. Don't tell them this. They don't need to know this. They don't need to know all the details behind this and so on.
Right.
So I think you came to realize from your experience with your daughter that they are not, they're actually sometimes stronger than us because they are just born in a different generation. I think it came in the right time, despite all the recommendation not to. Right. It came in the right time where kids at this age are prepared for this level of knowledge, for this depth, for these specifications, that they're able to deal with it, especially that this came with technology, advancing in technology, and having this smartphone in my hands with all those potentials that it has. It became very easy for this generation to absorb all those details and apply it in their daily life. Unlike us before, our generation, we only had TV. And we only watch whatever they tell us to watch, whatever they have on the TV. But now they have this, they can choose. Every moment they have the ability to choose what to read, what to listen to, and what to write. So all this gives them this capacity to deal with all those details. Maybe we are more fragile than them now.
Oh, no, yeah. And you just keep getting to enrich yourself any way that you see fit. And I'll tell you, too, there's an aspect of forward thinking that impacts the podcast success that you would never consider. But it's that 10, 15 years ago, if I would have done this, let's say the technology existed and I could have done this, it's a full-time job. So Arwa, I have to sell ads on this podcast. If I don't, I can't do this, right? So 10 or 15 years ago, if I had a podcast, this same podcast, and it had ads on it, people would have yelled at me for making money from diabetes. They'd say, well, you can't make money off of someone else's illness, and ads are insulting to me. And trust me, I've seen it happen to people. But somewhere in the last handful of years, people became savvy enough about the internet to understand that if you want somebody to give you something that is consistent and quality, that they're going to need to put time and effort into it, and that they have lives as well, and bills and families. And so suddenly it's an idea that's gone in the world. Like, no one watches a YouTube video and when the ad comes up, yells and screams at the ad. You go, all right, I understand. I'm not paying for this. The ad's paying for this. I get it. And now that that's acceptable, that actually supports me, because honestly, I record with you today, someone tomorrow, another person on Thursday. In the last 48 hours, I've edited together 5 episodes and prepared them to be online. I've probably put 45 hours into the podcast in the last 4 or 5 days. And wow. And that's a job, right? So now I'm suddenly able to do that because of people's acceptance and growth and understanding of how the world works. Everybody needs to understand reality so that they can have reactions and experiences that are real, and not just, I'm going to be mad at you because you have a podcast and it makes money and I wish I had a podcast. You know what I mean? Or something like that. It's just, it's a growth of people that's allowing us to help people grow. It's really cyclical.
Right. Yeah. And I bet you also have some of your fans are probably YouTubers too, right? Because now all kids are YouTubers. They all talk in the YouTube language. I have my nephews. They know all the details behind how to become a YouTuber. They know how much money they will give you. They know what is the guidelines and how long is your YouTube should be and how many likes you get in order for you to sustain. I'm talking about kids who are 11 years old or 9 years old. You know the language I'm talking about.
Right. No,
is something very advanced. Yani. So that's why it's easy for this generation to understand why you need to maintain ads in your why you need to have ads in your show, etc. It's very easy, unlike before. So I think it all happened just in the right time.
It really did. And there also seems to be this idea now that people seem to want good for other people. Like it's not as competitive anymore, I guess. So they look at you and they go, "Oh, you have an ad in your podcast? That's cool. I hope to have a blah blah blah." And they're excited by the possibility. And I talk this way about diabetes as well, because there used to be a fervent idea that you did not share your success with insulin online. Like, don't show people flat graphs. Don't show them that you could bolus for pancakes, because you're showing off and you're making other people feel badly. Well, I didn't believe that. What I thought was that if I could do it, then maybe you could believe that you could do it. Right? Like to have an example in front of me that's like, wow, that's possible. Oh, okay. Well, I'll try that. And I think that people feel the same way about the podcast. Older people will look at me and say, "Well, you make money from a what now?" And they're almost mad about it because they worked the last 30 years in a car plant manufacturing cars. And I get it. Like in their mind, I'm sitting in a room and I'm just chatting. But younger people are like, "Oh, that's cool," because they see it as a way to live. Whereas older people see it as a like somehow like you cheated. And it's all just perspective. It's really terrific. I'm excited about what to come. And I'm excited that there are people like you out there having thoughts like this.
One more last thank you. One more last idea before it flips away from me. I think what was although I was a bedside nurse, and specifically the unit I worked at was subspecialized in endocrine and nephro. So I dealt with lots of newly diagnosed type 1 diabetes kids with a lot of DKA after they're stabilized, of course, not in critical care, but in the unit. However, my experience with one of my cousins who had type 1 diabetes since he was, I think, 11, and then with Julia specifically, being the first close friend of mine who had diabetes. So what was nice about this experience is that it simply normalized living with diabetes, even for me, for someone who was from the healthcare area. But I never lived with diabetes daily. I never had diabetes as part of my daily conversation or routine, or where I have to think about it all the time. Whenever we talk about, she will check her blood sugar, or she will mention her blood sugar, and then she'll mention something about the diet, or today I had my blood sugar, blah, blah, blah. That's why I'm feeling this now. And so it was part of the daily conversation. So it was, to me, like something normal. I'm not saying normal in terms of like, of course, they're not normal in terms of their physiological needs. They are different, but at least they're not isolated anymore, or just they have to be isolated just because you have this condition.
It helped
having this normalization, making even the conversation, the terminology, very very, what do you call it? It's reacquainted, so everyone knows it, and it's not something. Oh, you have diabetes, and I don't need to feel sorry about you anymore. I just feel that this is part of life. Someone has diabetes, someone doesn't, and that's it. Yeah, this is how life. But before, you don't know that there are a lot of people who are experiencing this on a daily basis, and you have to deal with it. So what I like about an approach of Julia, where she used to share this with us all the time, it was normalizing it to me. I was not stressed out or worried whenever this topic is mentioned in front of me. I'm more prepared to deal with it, even psychologically.
That's amazing.
Just because it happens in front of me all the time.
Yeah.
So I think even podcasts like yours serves this purpose unintentionally, where you're meeting with people, different countries, and you're normalizing the experience of type 1 diabetes.
Right.
And making it very special, honestly.
It's an out and proud mentality. It really is. It's just like, I'm not going to hide anything. You get to see it. And then, like you said, after I see it a number of times, it becomes normal to me, something that I hadn't seen before. And then that's it. The issue's gone. It just disappears into the ether. That's all you have to do is, what do they say? Sunshine's the best antiseptic. Is that the saying? I'm probably not right. Now I've said it, and I'm gonna hold on a second. Sunshine. I'm gonna find it. Is the sunshine is the best disinfectant, which just means bring things out in the light of day, and it takes care of the rest.
Right.
And that's amazing.
Right.
Yeah. It's very exciting. So would you say in general then, based on your studies and what you're saying, is to take someone with an illness and understand, hopefully, that illness isn't such that's it's going to end their life. If it's something you're going to live with, that you need to get up and get back to normal as fast as you can, and that you might need to understand that you're going to need some support in different places. Yes, but that the most important thing you can do is to not stop, keep going, and don't give away the idea that the life you thought you could have is still available to you.
Right.
Yeah.
Absolutely.
That's it. I love it. All right. We did it. Thank you.
Yeah. Thank you. Thank you for giving me that chance to share my perspective from 1,000 miles away. I hope things went very well with the recording, and thank you very much for this opportunity.
Oh, you're very welcome. No, everything's great. You sound terrific. I've got your recording captured here, and I'm super excited to share it with people. A huge thank you to one of today's sponsors, Gvoke Glucagon. Find out more about Gvoke HypoPen at gvokeglucagon.com/juicebox. You spell that GVOKEGLUCAGON.com/juicebox. I'd also like to thank Touched by Type 1 for their continued and long-time support of the Juicebox Podcast. Check them out at touchedbytype1.org and find them on Facebook and Instagram. Don't forget the T1D Exchange, t1dexchange.org/juicebox. Take a few minutes and fill out the survey.